Hello, this is Dr. Stanley Lang. Welcome to this presentation, and the question is how to give babies probiotics, and the related question is, do babies need probiotics? So we'll try to address that question today, and I'll just give you some things to think about, because the second question has not been definitively answered by any kind of science, although there are many people that believe that there is a significant role for probiotic supplementation for babies and for basically all people who live in Western society. The reason for this is because all people are subjected to a highly polluted food source that damages the gut biome. And if you're not replacing good bacteria, even with your best intentions, you're going to be polluting the gut biome with chemicals that will damage those good bacteria. And this is true even for babies, and it's true even for babies that are being breastfed. We know that breast milk, in many cases, contains scores and in some cases even hundreds of chemicals, many of which have been shown to be damaging to the gut biome. The biome is a word that means the community of bacteria that live in the GI tract, not counting the fungus and viral elements to the biome. So we know that the biome is being damaged almost from day one because the chemicals are everywhere that damage it. So there are some clinical situations where it's more apparent that the biome is having some trouble. One of those is a very common condition that babies have, which is reflux or gastroesophageal reflux disease. Now, they don't have heartburn, but research long ago showed that many babies with colic, if you treated them with an acid-suppressing drug, their colic symptoms got better. See, babies can't tell us why they are unhappy most of the time, and they can't tell us why they're uncomfortable. But some of the time, their bowel is dysfunctional because just like adults, when they're having gastroesophageal reflux and acid is going up into the esophagus too much, they get reflex spasm of the bowel, just like adults get irritable bowel syndrome from their reflux much of the time. So I saw a patient today that was a relatively young baby who was having reflux symptoms. And the mom did not want to use medication, nor did I recommend it. The baby wasn't that sick from the problem. So we talked about the idea of using probiotics and how to deliver them. And so my recommendation for both babies and adults and everybody in between is to not use probiotic supplements, except in rare occasions, but to use probiotic foods, which means foods that are still fermenting with probiotic bacteria. And so the easy way to administer probiotics to a baby is to simply dip your finger into a liquid version of that food and let the baby suck on your finger. We all have, if anybody has ever taken care of a baby, examining babies, we know that they love to suck on stuff, and they love to suck on fingers that have something on them, and they even love to suck on fingers that don't have something on them. So it's an easy way to administer the two major probiotic sources that I recommend for almost everybody, which is number one, organic apple cider vinegar, and number two, kefir. So kefir is fermented milk, and of course the big rule is don't give milk to babies under 1 year of age. But the reason for that rule is because the proteins in milk damage the GI tract of babies. But kefir, especially if it's what we call double kefired, the proteins have been digested already. So in addition, the lactose is completely gone. So it's a very good pre-digested milk product to give a little bit to babies because of its very profound probiotic spectrum. So the same thing can be done. You'd have a little glass of kefir the mom can be drinking, and she dips her finger in the kefir, puts the finger in the baby's mouth, let the baby suck on your finger. Do that 3 or 4 times, excuse me, and do the same thing with dilute. I want to emphasize dilute organic apple cider vinegar. You want to at least dilute it to the concentration of 4 ounces of water for a tablespoon of organic vinegar. So you can do the 2 or 3 fingers in the water or in the drink. Let the baby suck on your finger, and then whoever's taking care of the baby, drink the rest of it, because those probiotics are going to do you a lots of good. So I think that probiotics are good for everybody. Probiotic bacteria, fermented foods are good for everybody. That's the best way to get probiotics for all age groups. And there's considerable evidence that babies inherit the dysfunctional biome that moms have, and that this is generational. And what we know, or at least there's research to suggest, that as each generation has progressed, the biome has become more and more out of balance. And so the baby gets a kind of out of balance biome to start with, way better than nothing, but pushing back against the chemicals is always a good idea, I think, regardless of age. And this is a very simple way to do it, even if your baby's breastfeeding, because remember, your baby is getting chemicals in your breast milk because you, unfortunately, cannot avoid the chemicals. Even if you're eating a purely organic diet, the water that rained on that food has glyphosate in it, among other chemicals. So hope you found this helpful. God bless and have a great day.